Welcome to Black Women's Health, a podcast, a platform for promoting Black women's health and healing. I'm Dr. Rahman, and I'm a board certified OBGYN. We're going back to the basics. Why, you may ask? Well, recent reports and surveys have shown that women of all ages have expressed that they don't have enough reproductive health information. They are confused about their reproductive organs and their respective function. So we're going to start slow. We're going to start with the basics. Females have internal reproductive organs, meaning these are the parts that you can't touch. They're located in your pelvis, behind your pubic bone. These are your ovaries, fallopian tubes, uterus, cervix, and vagina. The ovaries are the most important. Within her ovaries, a female is born with all the eggs she will ever have. She comes into this world fully loaded. At the time of menarche, known as the start of her menstrual cycle, she will start to receive signals from her brain, and a group of egg follicles, estimated to be about 50 follicles per month, will start to mature. However, only one will become the dominant egg follicle. The hormone levels, specifically estrogen and progesterone, start to rise. And that dominant mature egg gets released into the fallopian tube. That is called ovulation. Side note, birth control pills suppress ovulation. With birth control pills, there is no release of an egg. No egg, no baby. Yes, this is achieved through hormonal manipulation. And yes, it is effective. The fallopian tube sweeps over the ovary to receive the release egg. The fallopian tube is a conduit, a bridge between the ovary and the uterus. The sperm's job is to swim into the fallopian tubes and find that egg. The uterus. The uterus is a specialized muscle. And that egg, which has become fertilized by the sperm, will develop into an embryo. And that embryo will keep dividing and turn into a fetus. And approximately 280 days after conception, you have a baby. And the uterus, it's a special muscle which is able to expand with the growing pregnancy and then to contract and expel the baby and the placenta. It's amazing. The organized, repetitive contracting of the uterus to expel the baby is called labor. We still don't understand fully how the body does this, or how this process is started within the female body. Now, the uterus is well known and often spoken of because you can have abnormal bleeding from your uterus, or you can develop fibroids and adenomyosis within the muscular wall of your uterus, or you can have an IUD placed into the cavity of the uterus for contraception. There is so much more that we could talk about. But at the opening of the uterus, which is at the top of the vagina, we have the cervix. When you get a pap smear, a sample of cells are taken from the exterior portion of the cervix, and that's the part that is in the vagina, and a sample is taken from the canal that leads from the opening into the cavity of the uterus. In this diagram, you can see that the vagina is below the cervix. You can put your finger in your vagina, and if your finger is long enough, you could touch your cervix. The penis is inserted into the vagina. Sexually transmitted infections get deposited into the vagina, and then the organisms can travel up into the fallopian tubes, up into the uterus, setting up what we call PID, pelvic inflammatory disease. The hymen is the film of tissue that covers the opening of the vagina. For the majority of women, the hymen does not completely cover the opening of the vagina. And how do I know this? If the hymen completely covered the opening to the vagina, our menstrual flow would not be able to come out. The menstrual flow from the uterus would have no way out. So, checking for an intact hymen is not a good test for female virginity. There is so much more to talk about. Until later, this is Dr. Rahman saying, take care.